I'm Dr. George Bacris, Professor of Medicine at the University of Chicago and Executive Committee member of the Cardiometabolic Health Congress. I want to welcome you all to expert perspectives and discussions, what you need to know about optimizing cardiorenal outcomes with novel non-steroidal MRAs. This meeting's going to happen 7:30 to 9 p.m. at the Marriott in Chicago on Sunday, November 6th. We're going to be joined by Sylvia Rojas, who's not here with us today, and
I'm Pam Taub. I'm a cardiologist and professor of medicine at UC San Diego.
And
I'm Rajiv Agarwal. I'm a professor of medicine at Indiana University and a practicing nephrologist at the Rada Bush VA, which is also in Indianapolis.
So we're going to be discussing various aspects of this. I'll be providing an introductory landscape of the area. And after that, Rajiv?
I'm going to follow George because he has got a very extensive presentation on the results in the phase 3 trials. But I will sort of nuance that compare it to the steroidal MRA like eplerenone and spironolactone, but also reflect on what impact it might have for the earlier treatment of people with type 2 diabetes and chronic kidney disease for cardiovascular protection, and emphasize a little bit about the screening of these patients through albuminuria checks, which is something which is not done very often. That's what my focus on the talks will be.
Pam?
Well, as a cardiologist, it's a true pleasure to be with nephrologists and really get their perspective on non-steroidal MRAs and learn from them, because they're the pioneers in the clinical trials with these agents and also have a lot of insights on how to use these agents. I will be presenting an actual patient case that will illustrate how we can apply some of these non-steroidal agents to clinical use. And I think from a cardiology perspective, one thing that we don't do very well is incorporate renal insufficiency, even mild CKD, into our clinical decision making. But it's very important to realize that even mild CKD really increases the risk of future cardiovascular events. And so we need to be thinking as cardiologists about really scrutinizing the renal function, looking at things that we're not often used to looking at, such as microalbuminuria, because when we do that and incorporate that into our clinical decision making, our patient outcomes are better. So I'm looking forward to presenting a case that really highlights some of the real world challenges that our patients face and how we can improve their outcomes.
So there you have it. Get your phones out, get the calendar open, November 6th, 7:30 to 9 p.m. Look forward to seeing you there, and until then, be safe.